Good morning. You're listening to Medicare and More on FMB Radio. I'm Megan,
And I'm David.
and today we're going to be talking about the biggest misconceptions about Medicare. So, Dave, you've been a broker for quite a few years.
About 12 years, I believe.
And what would you say is the biggest misconception that you remember?
That's hard. There's quite a few that I can think of right now. But off the top of my head, I'm going to say that Medicare Advantage is for poor people, and Medicare Supplements is for rich people.
Well, you're right about that. A lot of people who are on supplements they like their supplements. And I actually had a client this year that made the comment of, I hope to never get on Medicare Advantage, even if we go broke.
Mm.
So, I nicely corrected her on that.
So it is a misconception. We have some of the wealthiest people I've ever met go with a Medicare Advantage plan. And on the flip side, we have customers that are not of means that have Medicare supplements. It's really not so much about how much assets you hold or what your income is. It's more about what meets your needs and what gives you the peace of mind so you can sleep at night.
Right. And a lot of people go for Medicare Advantage because it's just an easier transition from an employer plan to that. And I personally like Medicare Advantage because it's all wrapped up in one ball. I don't
Oh,
have
yeah.
and I don't have to do this and then I have to do that. And in addition to, you also have vision and dental included in that.
Yes, so one of that is one of the big selling points of Medicare Advantage. You have just one card for doctors and pharmacies and the dentist and your vision doctor. Where Medicare supplements, if you want all that kind of coverage, you're going to have your Medicare card, you're going to have your Medicare supplement card, you're going to have a prescription drug card, and then if you want it, a dental and vision card, and so on and so on.
You're absolutely right. Because even with a supplement's a different company, Part D's could be a different company, and just your Medicare card in general.
Yeah.
That's three cards right off the bat.
And before you know it, your wallet's getting kind of fat, and then next thing you know, you're kind of leaning to one side when you sit down, kind of like that episode of
Seinfeld. Yes.
George, you're looking like the Leaning Tower of Pisa over there. I think you need to clean out your wallet.
Yeah, exactly. You're absolutely right about that. The other misconception I've noticed is you have to be on Medicare at the age of 65.
Yes, yes. And I think that roots mostly from people that just they don't understand the Medicare system yet. And that's totally understandable. But the thing is, if you are still working and you want to work past the age of 65, you want to go to 66, 66 and a half, 67 to collect that full Social Security check, the best thing you can do is to talk to your HR department and find out some information about your insurance. Find out, are they going to allow you to keep your insurance past the age of 65? Because some companies are going to kick you off once you turn 65 and you're eligible for Medicare. They're going to say, it was great working with you, but you're going to have to find insurance somewhere else.
Mm-hmm.
Other companies are going to force you to get Part B of Medicare to keep their insurance, because sometimes that insurance turns into a Medicare supplement or it turns into a Medicare Advantage plan. It works a little bit differently. Sometimes the premium goes up, sometimes it goes down. It depends on the company. So you're going to need to talk to your HR department or whoever manages your health insurance where you work and find out what is going on when you turn 65 and find out what your options are, because you could lose it, you could keep it, or sometimes you could keep it, but on the individual market, you get better coverage. Sometimes you're going to be able to cut your premium in half. Sometimes you won't even have a deductible, because sometimes with employer insurance, it's okay, but it's not great insurance.
You're right, and that also depends on how long, at least in Florida, how long you've been with the company. Because there
Sure.
are large companies in the state to where if you've been with them for 20, 30 years or like before a certain year,
Disney comes to mind.
Disney comes to mind, and Universal's probably the same way.
Sure.
Where it's if you've been there before 1991, I believe, then you have the Cadillac of insurance and there's no point in going to Medicare. Because even when I was there, and I was hired in 2000 before I left,
Right, right.
and I've talked to people that have been there since the 90s, and they said, you can't get better than this. Like, I've talked to Medicare brokers, and you can't beat my current insurance.
Yes, yeah.
And there's also postal workers.
Oh, yeah.
Yeah. Are there any other companies like even come close to you came and beat Medicare?
So I would say uh, federal government employees like postal workers, anybody that has federal Blue Cross Blue Shield, career military, because then they're getting TRICARE for life, and the spouses are going to get what is called Champ VA. You can't beat that. Then there's also some people that retired from or have like UAW benefits, like those big unions from mostly Midwestern states, like Michigan, Illinois, Indiana, that part of the country.
Oh, like your dad
Yes, yeah,
retired from the state of New Jersey.
yes, yeah. So if you retired from, one of those states like in the Northeast, New Jersey, New York, you're probably set on Medicare. But make sure you at least take a look. Don't just say, "Yeah, I retired with UAW benefits or retired from the state of New Jersey." It never hurts to at least take a peek and find out what's out there, because those benefits, depending on what, like you said, depending on when you retired, there's often a hard line drawn in the sand, and in some cases, sometimes even I get surprised. So it's worth taking at least a look. It doesn't cost anything. It's always a good idea to at least take a peek and see what's out there.
Exactly. And that's better to have a knowledgeable broker as opposed to an agent who's just going to push one thing down your throat,
Yes, yeah.
too.
You want to work with somebody that represents several different companies, so you're getting several different perspectives at one time. The agents that represent one company, there's a chance that one company might be the best option for you, but it's unlikely. And we have a saying around here that the one trick ponies, as we call them, you know, when you only have one tool in a toolbox, every problem looks like a nail.
Yeah. Especially those brokers on YouTube that only talk about the benefits of Medicare supplements when that's not even true.
Yeah, they exaggerate a lot. Don't get me wrong. We do like Medicare supplements here. They're a great product. We're not biased toward any one product, but we want to make sure that the right product is being put with the right person for the right reason.
You're right. And in their videos, they make you believe that MAPDs are only good if you're healthy, or vice versa. Med subs are only good if you're sick.
Yes, and that's another misconception. Medicare Advantage, we hear this a lot. Oh, it's only good if you're healthy, and then maybe I'll keep it for the first year or two, and then I'll go with a Medicare supplement when I start getting sick. And the thing is, and we've actually seen the opposite in many cases.
Yeah.
We've had customers that were diabetic, for example, that had a Medicare supplement. They were paying, $2,000, $2,500 a year in premium for a Medicare supplement, and then they were paying another $2,000, $2,500 a year for drug coverage and copays combined, picking up their prescriptions. So all in all, they were shelling out like $5,000 a year or so. And there was this one customer in Inverness, for example. She was very adamant about going with a Medicare supplement. And for this reason, too. She's like, I'm not healthy. I want this for this reason.
She was on some heavy drugs, if I remember right?
Yes, yes. She was a diabetic. And I said, okay, this is great, I'm totally okay with supplements. But when I did the research, I found this one Medicare Advantage plan that was what is called a chronic special needs plan, CSNP for short. Mm-hmm. And when I saw how much she was going to save on her prescription drugs, especially, it was when I met with her, I said, "Ma'am, I know you are very adamant about a Medicare supplement, but I wouldn't feel like I was doing right by you if I didn't at least show you this." I said, "Give me 30 seconds. I just want to show you the bottom line, how much you're going to save. And if you're not intrigued by the savings, by this number, I won't show you the plan. I just want to show you this. Otherwise, I wouldn't feel like I was doing my job correctly." So I pulled out the savings, the comparison Medicare supplement costs versus the Advantage plan. And I showed her she was going to be saving $5,000 a year.
That's crazy. And every little bit helps right now.
Oh yeah, I mean you're talking $400 a month. That's a car payment,
Yeah.
So she was like, "Okay, I'm intrigued." So I showed her the plan. The only downfall was one of her doctors didn't accept the plan. But when she saw the savings, $400 a month, $5,000 a year, she was like, "Well, I guess I'm not married to that doctor."
No, I wouldn't think so. And we do have good doctors in this county. Like they're hard to get into, but they're worth it.
Oh yeah.
And we all know Medicare is not free.
Yes. Yeah. So that is one thing, and I want to get back to that Medicare is not free thing, but just to get back to the healthy thing, some of these Medicare Advantage plans, they're designed for people that's not sick, and the Medicare supplements, it goes back to what your needs are, what your peace of mind, what gives you the peace of mind so you can sleep at night. So it's a misconception. And it's really about what your needs are. But you said something just a minute ago. Medicare is not free. And that's true.
No, it's not. Nothing is free.
Exactly. So you have a Part B premium in 2024. That's the base premium for most people is $174.70.
That's automatically deducted from your Social Security.
Yes. And if you're not collecting Social Security, then it's a quarterly payment. You just write a check to the U.S. Treasury once every 3 months and you send it in. Mm-hmm. But it goes up if you break into some higher income brackets too.
Does that also keep up with inflation?
Yes. So one thing to know is it's nice is that it doesn't outpace inflation. There's this thing, this rule in the Social Security law called the hold harmless rule, which keeps the Part B premium from outpacing inflation and the rise in your Social Security check. So one thing to know is that premium won't be outpacing inflation. That's for the Part B premium only. That doesn't count for Medicare supplements. That's important to know.
Mm-hmm. And for Part D's as well.
Yes. So Part D as in Delta, does not... That hold harmless rule does not apply to that, and we've seen that happen quite a few times.
Especially this year when the premiums have increased, as well as the deductible.
Oh yeah.
And it's probably going to go up next year.
Yeah, we seen them going up like literally 100%. Premiums went from like 30 to 60, $70 a month.
Mm-hmm. You're absolutely right. I had a question. One of my clients wanted to cancel her MedSup and go to MAPD, but she was so afraid that she wouldn't be able to get her MedSup back if she would have been able to change her mind.
Mm-hmm.
And that's not true at all, because that's a guaranteed issue, right?
In some cases,
Right.
it can be a guaranteed issue, not necessarily always.
Do you want to explain that a little bit more?
So in many cases, we can find special elections where it will be guaranteed issue. Other times you have to go through underwriting, but we did have one customer this past year that wanted to go back to Medicare Supplement, and we were able to maneuver in a way that we were able to get her guaranteed issue a new Medicare Supplement. And in case y'all don't know what those terms mean, guaranteed issue is exactly what it sounds like. No medical questions were asked. It was issued, approved by underwriting, guaranteed. But in other cases, yes, you do have to go back through underwriting. But I'll tell you, it's not like you're buying a $1 million life insurance policy. You're not going to have a nurse come out to your house and do an EKG on you and weigh you and poke and prod you in all these different kinds of ways. It's relatively easy underwriting. They're going to be looking at what kind of prescriptions you're taking. They're going to be looking at your medical history. Have you been in the hospital as an inpatient in the past year? Do you have cancer? That sort of thing. And if you can say no to these questions, we'll be able to find you a Medicare supplement. But I'll tell you, in 12 years, I can count on one hand how many times we were not able to get a Medicare supplement issued in 12 years. I could count those times on one hand.
Mm-hmm. And I've heard you talk to underwriters personally
Yes.
and what they needed to do, what they were looking at, essentially.
Yeah, so we have enough experience and we represent enough companies where we can usually almost always find a company that's going to get approved for a Medicare supplement.
Yeah. That was another question I had this year, was how we get paid. Because a lot of people think that the clients are the ones that pay us. That's not true either.
Yeah, so it's commission based, and that shouldn't be much of an issue for people. So I mean, our services are free. It's just like a travel agent or a realtor or something. Actually, not a realtor would be a bad example, unless you're on the buy side. If you're on the sell side, you are paying a realtor out of your pocket. But on the buy side of realtors, it doesn't cost you anything.
You're right. And I've noticed that there's a difference between us and other brokers because we like that relationship with our clients.
Yes.
We check in with them every year to see how their plans are working, and they are always welcome to call us as well throughout the year.
Yes, yeah.
And we know a lot of, it doesn't even matter where you're listening from, because there is a large community of brokers, and we all communicate with each other.
Yeah, we have a nationwide network, but we focus mostly on the state of Florida.
Yes, because everybody is state licensed.
Yeah.
And every county has different plans.
Yeah, yeah. So, I mean, it doesn't matter if you live down in Dade County or Duval County, or if you're up in the Panhandle, around Pensacola or Apalachicola, or anywhere in Central Florida around Orlando, Ocala, Gainesville, Tampa, whatnot. We can help you. We work the entire state, and we have agents scattered throughout the entire state.
Yeah, and if you ever have a question about anything on how to get started, or just a general question, you can check out our website at MedicareBrokerFlorida.com and then just submit a general question, or even on our YouTube and Rumble pages.
Yeah, and our handle there is Florida Medicare Broker.
Yeah, just comment on any one of the videos, and one of us will answer it, and you'll get an unbiased opinion. That is so important.
That is the biggest. I would have to say it's one of the biggest difference between us and a lot of other brokers out there, because many agents they call themselves brokers, but they're really not.
They're burn churns.
Yeah, they're burn insurance, and they only represent like one or two companies, or they're biased toward one product. You know, they only sell Medicare Advantage, or they only sell Medicare Supplements. Where the only thing we're biased about is that you get the product through us. We don't care if you're looking for a Medicare Supplement or Medicare Advantage plan, whether it's that company or this company. We just want the opportunity to earn your business.
You're right. Oh, and you actually had a perfect example not too long ago where this one of our newer clients she called 5 different brokers,
Yes, yeah.
and they all wanted to sell her a supplement or whatever, like whatever plan was strong in her county.
Yeah, I think it was most of them just kept talking about Medicare Advantage.
That's what it was.
And they weren't listening to her needs and her fears and everything.
And she did the research.
And she already did a lot of the research and everything already. And she was just wanting some clarification on some of the different supplement plans and the different companies. So we sat down with her and we talked about Plan G as in golf and Plan N as in November, and we explained the differences, and also a high deductible Plan G was another one that she was curious about, and we showed her the different prices of all the different companies, and I think we ended up showing her the prices of like 8 different companies, literally. Something like that, and I believe she ended up going with a Humana Medicare Supplement plan.
And Humana's a good company.
Humana's a great company. Yeah, they're not going anywhere anytime soon.
No.
And the thing was, it gave her the peace of mind. It protected her the way she wanted to be protected, and she's as happy as a pig in mud now.
Well, let's not call him a pig, but she's happy with what she has, and she's grateful. She was relieved that you were open to the research that she did, and you weren't biased one way or another.
Yes.
And that's like I said, it's very important to find someone who's going to show you both options if you're interested in them.
Yes, yeah.
And that they're not biased towards one another. But that is all we have for this morning. I hope you guys have a great rest of your day, and we will talk to you soon.
Thanks for your time, y'all. Take care. Bye.
Bye.